Hello, and welcome back to this segment of Stay at Home, a new series from Jacobin, where Monday through Saturday, 6 days a week, 6 p.m. Eastern, we'll be talking with a left-wing thinker who will be presenting and then taking questions from the live audience. My name is Christy Offenbacher. I am a clinical social worker and a psychoanalyst based in New York, where I also organize with DSA's Medicare For All campaign on a national level. I organize there with the guest that we have tonight, Michael Lighty, and I'm thrilled to be hosting him and speaking with him on this topic, a pressing one, an urgent one, especially in the midst of this crisis, which has brought this series to you, which has necessitated this series in the first place. Michael is the Healthcare Constituency Director at the Sanders Institute, but importantly, he was also with National Nurses United, which is the largest union of nurses in US history. He was there for 25 years, and National Nurses United is a major partner that's been working on single payer as at the forefront of single payer advocacy for a long time now. And Michael is really a preeminent expert on the movement for single payer. I hope that you will all take advantage of the question and answer box during this live session, because you really have an expert with you. You have somebody with years of experience in this field. So just to tell you a little bit more about what we have coming up. This week, tomorrow night, we'll have Torrey Reed speaking on the pitfalls of liberal anti-racism and woke neoliberalism. Later this week, on April 8th, we'll have David Kalnitsky. April 9th, we'll have Sia Weaver. April 10th, we'll have Adolph Reed, Cedric Johnson, and Willie Leggett with Michael Brooks. And on April 11th, we'll have Matt Brunig. So please stay tuned for that. Tonight, we've asked Michael to speak a little bit about where we go from here. What is the fight for single payer in the context of the coronavirus? How can we keep a strategic mind as we look to this crisis to think about how we can be building structures and a path forward to winning single payer for us down the road. So with that, we'll turn to Michael. And again, please be asking questions in the box on the side of the screen so that we can be filtering those and going through and preparing to ask Michael your great questions while he's speaking. Go ahead, Michael.
All right. Thank you, Christy, and thank you all for joining us at this Jacobin Stay-at-Home series. I am at home, and I've been staying at home for over a couple weeks now in California. And it's not an exaggeration to say everything has changed, but on the other hand, nothing has changed. We have, of course, with this pandemic, just a horrifying week ahead of us, according to the Surgeon General, who doesn't necessarily inspire confidence, but he's probably right about that. And we know today that we passed 10,000 deaths in the United States from COVID-19. So it is a very profoundly sad moment, and everything seems to have changed. And yet, and those include the COVID pandemic has opened up political possibilities as the government expands rapidly and provides a greater safety net. But nothing has changed, because at the same time, the forces of finance capital and the corporate control of politics has produced in the stimulus bills huge giveaways to corporations and stingy support to workers. In healthcare, the federal government is paying for treatment for all the uninsured. If it's COVID-19, it's commandeering facilities, putting Navy ships at the disposal of domestic cities like New York, and expanding public health services. Yet doctors, nurses, and other healthcare workers do not have the protective equipment that they need, and care is being rationed in hospitals to those without COVID-19. Everything's changed, nothing has changed. Typically, on any given day, US healthcare is rationed. It's just rationed based on ability to pay. That is, who can afford insurance, who has a good job with insurance, who can afford the copay and deductibles. And we still see those inequities on full display, and who gets tested, who gets admitted to the hospital. And now, perhaps on the front page of the New York Times, there was a discussion of who gets a ventilator. And underlying the morbidity of this of this unique or this novel coronavirus, as it's called, are chronic health conditions. And these conditions, of course, are chronic and socially determined. And it's unique in the US that two-thirds of Americans by the age of 65 have two or more chronic conditions. Similar countries have less than half the population with two or more chronic conditions. This is way above average for similar countries. Specifically, obesity, diabetes, high blood pressure, smoking are all more prevalent among the poor, among low wage workers, and in Black communities. And these are precisely the communities that lack quality healthcare. And those are precisely the factors that are high comorbidity factors for death from COVID 19. And so this is not a surprise. This is a result of how healthcare has been structured as an industry. And that industry has replaced what used to be a caregiving system. And so, like COVID 19, like the hurricanes of Katrina and Maria, it reveals the disparities and inequities that we're hiding every day in plain sight. And this day really started 40 years ago when both Ronald Reagan was elected president of the United States, and it's been identified as the starting point for when healthcare became an industry and replaced those caregiving institutions like community hospitals, now corporate hospital chains, nonprofit insurance companies, now for-profit insurance companies, pharmaceutical companies providing vaccines and low-cost prescriptions, now the most profitable industry in the world. That has been described by healthcare journalist Elizabeth Rosenthal as the fundamental transformation in American healthcare, whereby money became the metric of good medicine. And what does an industry model do? An industry model emphasizes revenue and profit. So that means we've got to de-skill the workforce, only employ labor as much as we need. That means just-in-time production and inventory. That is, we don't keep a lot of supplies on hand because that's just a cost center. Let's only have the supplies we need and bring in the others as we need them. But at the same time, we've closed hospitals. We've reduced beds in hospitals. We've reduced capacity. We've lowered staffing driven by budget and revenue demands. And so an industry model inherently creates shortages of supplies, equipment, and capacity, and undervalues labor so that any impact of the system from a pandemic or even just a bad flu season can overwhelm hospitals. So we are literally engaged in a public health strategy primarily designed, well, to stop the spread of infection, but also to prevent our healthcare system from being over capacity. And yet structurally, inherently, it is over capacity whenever we need healthcare, because this system is based upon only giving us the healthcare we can afford and limiting the healthcare to only that which makes them money. In that system, you're simply not going to get the healthcare you need. So everything has changed, but nothing has changed. We still confront that industry. And how are we going to confront that politically? From the historic record, it seems that, and I've been arguing this for a while, as many others have, that really it takes presidential leadership to transform the US healthcare system, and with a movement capable of propelling that transformation. We had that in the 1960s after nearly a decade of organizing. The civil rights movement and the labor movement were able to convince first President Kennedy, and then after his assassination and the election of President Johnson, to champion Medicare. And that eventually became also Medicaid as well. And so that civil rights movement and the labor movement with President Johnson established the principle of guaranteed health care for seniors, and in the process desegregated those American hospitals that were still segregated. So that gives us a sense of what it takes for a president to move congressional leadership. And that's why we felt that the necessity of clear progressive presidential leadership on healthcare and other issues is why we supported Senator Sanders. At the same time, though, it turns out that a pandemic can alter the political calculus perhaps even more profoundly. And I know some of us have been looking at 1918 and the changes that derive from there. Also, the history of California, where I live, is a history of emergencies propelling the state in profound new directions, usually in directions that enhance collective health and safety and security and the ability of workers to create a better life. So, for example, after the 1906 earthquake, there was no longer just a focus on development in the wealthy city of San Francisco, but that development actually extended throughout the state. Those kinds of these kinds of political moments change what is considered possible. And there's no better example than what we're living through in this pandemic. I mean, just today, the American health insurance companies, AHIP, put out a ad about how much they're doing, how, oh, we're expanding public health, we're eliminating copays and deductibles. We're providing, quicker access to treatment. All of a sudden, all those things that they did when their revenue model prohibited it, denying care, requiring pre-authorizations, high copays and deductibles, all of a sudden that's off the table. And hey, the insurance companies are just there to help. One might get the impression that they're actually fearful of what the future may bring. As well they should. Of course, what's ironic is that in this year's presidential primary, we've spent a lot of time, in fact, most of the time, it seems like, debating job-based health insurance. And now 3.5 million workers have lost that insurance, as over 10 million workers have filed for unemployment. Statements made about healthcare from a month ago seem like from a different era. But structurally, the same political forces that have stymied adoption of Medicare for All, led by the Partnership for America's Healthcare Future, that's an industry group that's spent, upwards of $10 million so far. I like to call them the Partnership for Future Healthcare Profits. But this group has crafted bipartisan messages. In fact, that's where really the issue of job-based insurance came from, is from Democratic consultants advising the industry. They've also deployed unified GOP opposition. Who can forget, I guess if you're a political junkie, who can forget the Conservative Action political conference where they railed against socialism and the expansion of government, only to find the Trump administration doing that. This industry group has branded Medicare for All as too radical, favoring instead building on what works. Now, that sounds very familiar. I think during the Democratic presidential campaigns, we heard a lot of that. It really is in similar form the centrist Democratic position. And even after the declaration of a national emergency, the frontrunner for the Democratic nomination said single payer won't solve that. Joe Biden invoked the problems of Italy as some of his supporters who still want to prosecute the case against Medicare for All. Here's what Joe Biden said most recently.
As you've been seeing, our healthcare system seems to be crumbling underneath this crisis. There is not enough. There's not enough support for the healthcare system. There's not enough support for the American people inside of the healthcare system. Are you now reconsidering your position when it comes to single payer healthcare?
Single payer will not solve that at all. The thing that is needed is, for example, we have a whole number of hospitals that are being so stretched, including rural hospitals, they're going to need more financing. That doesn't come from a single payer system. That comes from the federal government stepping up and dealing with the concerns that they have, the reimbursement that they're going to get, how they're going to be able to move forward, and how they're going to be able to provide all the needed help that are needed in their communities.
Joe, who do you think the federal government is? Who's paying for it? That's the single payer. I love that video. It's basically, hey, single payer won't work, except here's how single payer will do it. So it is frustrating at the same time. It's only funny in its absurdity because, of course, what would single payer do? it would provide exactly the kind of support that the vice president is referring to. But here's the difference in this comparison to other countries. Austerity kills national health systems. Healthcare industry greed and profit kill people in the US. So when a publicly funded health system like Italy or Spain or France faces a public health crisis, all the budget cuts that have been going on really for over a decade now come home to roost, and they debilitate the system's response. But people don't get access to services like testing based on their insurance plan or based upon their class connections. They don't get bankrupted by a diagnosis. They don't worry about whether they can afford to even go to the doctor for a test. And these countries respond nationally, not through haphazard state programs where the governors are trying to outbid each other for the profit-making equipment that Walgreens or CVS has that they need. They don't do that. They are organized to provide equitable treatment throughout the country. Healthcare systems can't stop a pandemic, but can organize the response centrally and equitably, address shortages, and know that the social welfare system, tattered but intact, is still there. And we do not have that in the United States. And in the face of this new pandemic reality, constrained by the ongoing structural power of the healthcare industry, we must take some new paths strategically to win Medicare for All. I do think a good starting place for that is the three principles that the World Health Organization has identified for containing and treating what was called the SARS-CoV-2 pandemic. And these principles outline by the World Health Organization could lead to a system of guaranteed healthcare through Medicare for All if we're able to organize around them and pursue them. Of course, number one is enhance public health infrastructure. Number two, eliminate financial barriers to care. And three, engage in social solidarity. Initially, that's, of course, social distancing and these other practices. Waging the struggle over how to respond to this pandemic on the basis of these broad demands would establish the rationale and, if successful, the programmatic basis for Medicare for All. And you can see already, even AHIP, even the American health insurance companies recognize that a robust public health system, they've eliminated barriers to care in their way, except of course we're still paying for premiums. And no doubt will end up, they'll get their money back because they're talking about raising premiums by 40%. So whatever they're giving away now, believe me, they'll get back later, because the bottom line, nothing has changed. We pay for everything. So our fundamental policy task, though, is to convince people that government financing of healthcare is best. And that, of course, is an ideological fight, as we've seen played out in the presidential primaries. Enhancing and funding public health, though, uniquely makes this case. And as you saw from Vice President Biden, everything that he says we need to do to respond to COVID is also what we need to do to reorganize the healthcare system in a way that provides caregiving. And it's also the things that Medicare for All single payer does most effectively. So a stronger public health system that keeps people healthy, responds effectively to this pandemic, and is understood to be necessary, clearly it is, to prevent future outbreaks, is the foundation for universal guaranteed healthcare. And applying these principles to the current fight would also lead to the support of no copay and no cost for COVID testing and treatment, as the insurance companies recognized. And ironically, that's like Trump's policy of having the feds reimburse hospitals for all costs incurred by uninsured patients with COVID-19. Senator Sanders' proposal is better. It's for Medicare to cover all these costs for the uninsured and the underinsured, and it's provided that the current copay, and also rather eliminates all copays and deductibles that are currently associated with Medicare. So really, you can tell that if the insurance companies and others are saying, hey, you shouldn't have copays for if you've got COVID-19, well, why should you have copays if you have cancer? Why not for everybody and every disease would these same principles apply? And the third element, of course, is at the heart of our ideological and immediate struggle is solidarity. Social distancing is done primarily to protect others, as is wearing a mask and staying home. And we can see the chafing of this against American individualism is like watching an ideological wrestling match in real time. But it does create a huge opportunity for us, since solidarity is at the heart of our politics and, of course, at the heart of Bernie's message. And that sense of solidarity is created and fostered by national health systems. Not only do they organize national responses, but you've got, of course, the Tory Prime Minister, Boris Johnson, in the intensive care unit, praising the national health system. Literally, the NHS is the savior and essential lifeblood and system of the UK. And that sense of solidarity is fostered by the belief and reality that people are going to be taken care of. We do not have that in this country. Imagine if we did. That the politics of resentment, oh, he's got a better healthcare plan, or he's getting subsidies for healthcare and I'm getting nothing, I got to do it myself. That sense of resentment can fade away. And the pandemic is the perfect opportunity to build that solidarity that provides really the heartbeat of these national healthcare systems and creates an alternative ethos socially. And really, organizing for the program that Bernie published yesterday presents the clearest opportunity to link our immediate demands to the broader ideological struggle and creates favorable terrain for Medicare for All. So you have, for example, as I mentioned, the demand that Medicare pay for the uninsured and the underinsured. That means that people who have a high deductible will be able to get treatment. And remember, all of these allowances by the insurance companies or others for no copays or deductibles or payments depend on getting tested, but there are no tests. And the backlog in California still is 13,000 tests with a 12-day waiting period. So how can you get it? Should you go in for a test? Well, how do I know if I'm going to be able to get it? Can it get paid for? Well, if it's a COVID treatment, yes. But what if it's something else? No. And so already inherently, the notion that you can waive your copays and deductibles based on a test that's not available is kind of emblematic of the US healthcare system. But strategically, the objective should not be to just expand government, but to do so based on a rationale that shows the value of governmental action, to address a national crisis based on solidarity and the interests of workers. So the Senator's program is very broad. It includes economic assistance, $2,000 a month per worker for the duration of the emergency, and also addresses some of the other gaps in our present system, like the lack of paid sick leave, which of course encourages workers to come to work sick and bring that home. So if we can organize on these broader issues, and then we can see through the pandemic the gaps and divisions that, as I mentioned earlier, were hidden in plain sight. So the obesity, diabetes, smoking, and other chronic conditions concentrated cause higher morbidity from COVID, and only if we have a comprehensive response that goes way beyond just paying for COVID-19 treatment can we actually prevent higher morbidity when inevitably the pandemic returns, because we do need to start addressing these underlying health conditions determined so much by socio and economic status. But of course, it's a remarkable day because these issues like paid sick leave are on the table, and formerly expendable and exploited workers are now essential. The undocumented farm workers, for example, are temporarily exempt from deportation. Yes, class divisions and impacts have come to the fore. Frontline workers, whether they're in warehouses or hospitals, don't have the protective equipment, and celebrities can lounge in pedal-filled baths at home. This is ripe territory, particularly since Bernie's base was and is overwhelmingly working class. And class politics is good for us, and we should emphasize cash to workers in the short run and higher wages, paid sick leave, Medicare for all, and pensions on the list of demands immediately flowing from this crisis. But specifically on Medicare for all, our number one priority needs to be to shut down the debate over job-based healthcare. This was the cudgel that was used against us all year. It didn't work. The industry spent millions. The Democratic centrist basically went after Senator Sanders at every debate over it. The moderators attacked him. And yet, the majority of, I think, virtually every Democratic primary, those voters supported Medicare for All. The support for Medicare for All went up 9 points in just 1 week, which is why, of course, Vice President Biden was asked that question. So this is really objective reality. It's doing a nice job of totally delegitimizing the connection between jobs and health insurance. But the pivot from the ACA and the public option to Medicare for All is the signal we need from centrist Democrats, that they get it, that they understand that healthcare must be a human right. Until then, there has to be maximum pressure. And this really is essential, because if folks say, well, really, hey, aren't the unions leading this fight? We have to understand that the Democratic leadership is really in the pole position. The situation of unions is dire, obviously, when it comes to their institutional power in the workplace, down to 7% in the private sector. Yet there's this explosion of worker organizing around the pandemic, in particular, around the Fight for 15, around healthcare. And in fact, even the culinary worker union members in Las Vegas, whose leadership had gone after Senator Sanders on Medicare for All, ended up supporting Senator Sanders, and even the exit polls there showed supported Medicare for All. So we have to understand, in our gut, we know the healthcare system is fundamentally flawed, broken, and dysfunctional. Nothing has changed in that sense. We know that. But now we have to take advantage of the moment the pandemic has presented. And so maximum pressure on eliminating the legitimacy of job-based healthcare. If they don't get it, let's do creative actions. DSA member Ben Fong suggested car rallies at the homes of politicians. Let's go back to old-fashioned handwritten letters. We have the time. The impact of thousands of personal stories about the pandemic and the need for guaranteed healthcare would be powerful. Let's be clear. I'm saying guaranteed healthcare intentionally. It is the most powerful way to express our demand. The pandemic has made the case for universal healthcare, but guaranteed healthcare is an elaboration that's essential, because we need to know that we will be able to get the healthcare we need when we need it. And the pandemic has proven that not to be the case. And that security and peace of mind derived from that sense of all of us taking care of each other. That's the solidarity we need to create. And it's encapsulated in the word guaranteed healthcare, guaranteed universal healthcare. That's what we need. And of course, at the same time, and that's at the federal level, we may have openings at the state level that could be the most strategically valuable of all. New York clearly needs a reorganized healthcare system. And despite Governor Cuomo's good press, he still sought to cut $2.5 billion from Medicaid in New York, and that's unacceptable. We need to go to single payer in New York, or get as close as we can. Similarly, in California, you've got a supermajority of Democrats in the legislature, a governor who gets it, who's obviously expanding the public health response in the face of the pandemic. The winning single payer, getting the waivers from a Democratic administration in 2021 early to establish universal health care that will guarantee people get the health care they need in the two of the biggest states in the country would be very significant, perhaps the strongest policy move we could make toward Medicare for All. Now, the strongest force overall would be to unite national progressive organizations with the Bernie grassroots networks. Obviously, a lot of overlap already, but that powerful coalesced force could be the vehicle for transformation, regardless of who the nominee is. It requires a recognition that we have to remake the US along social democratic lines in order to address not only the pandemic and the underlying economic injustice, the racism that informs that, the fact that Black men are dying disproportionately from the pandemic, the fact that Black women are still not listened to when they go for maternal health, the fact that Native folks and Latino folks are the most uninsured. All of this comes home to roost in this crisis, those structural barriers to care that are financial, that are racial, that are gender-based, gender identity-based. Those have to be addressed in the context of this broader fight. But ultimately what's looming, of course, is the ability of government and us collectively to respond to technological change and the climate crisis. And clearly the pandemic has showed we've got a lot of work to do. At the human level, though, there is an increased recognition about the power of collective gatherings and their necessity and the value of solidarity. Amazingly, we can see a better world within reach if we organize. So thanks a lot for joining us today.
Thank you so much, Michael. That was a lot, and I can't wait to get into the questions that we have from the audience. Before we do that, as a reminder, if you're watching okay, I think none of that was heard. I think this is what I've been experiencing all week as I've been working from home, and probably many of you have as well. As I was saying, thank you so much, Michael. That was amazing, and I can't wait to get into the questions from the chat. If you are watching from home, you can put your questions in the live chat box. Don't use the normal comment box. We're going to be filtering through questions and continuing to figure this out as we go forward. For those who might just be tuning in now, tonight we're speaking with Michael Lighty, who is the Healthcare Constituency Director at the Sanders Institute, and also longtime worker at National Nurses United. He's been speaking so far with us tonight about the changing political conditions under the current coronavirus crisis, and what that means for maybe the changed strategic path toward winning Medicare for All, single-payer system in the US in the long run. Just as a reminder, tomorrow we will have Toure Reed on at 6 p.m. He will be speaking about the pitfalls of liberal anti-racism and woke neoliberalism. And with that, I think we'll turn to our first questions from the audience. We've got some good ones in here. I think these two kind of go together. So Michael, would you advocate to go from Medicare for All to a fully nationalized healthcare system like the NHS in the UK over 10 years? And another one sort of connected, what will nationalizing the healthcare system look like? Is it possible under a Trump presidency? What do you think?
Well, it's interesting because, it's ironic. President Trump is committed to never making Obamacare work. So what's the alternative, right? You could say, well, we'll just kind of muddle along and it won't really matter. We'll get elected and we'll kind of just keep railing against Obamacare. Maybe we'll make some changes and we'll, deregulate. But we're not going to have a healthcare plan because Republicans can't come up with one they all agree on. So then what do you do in the context of a pandemic? That's fine outside of a pandemic, but with a pandemic, you've got really obviously these much more severe problems. So the short answer is yes. I've always felt that the easiest thing for President Trump to do is to say, yeah, we're not going to do that Obamacare. We're just going to give Medicare to everybody. Isn't that the American way? And I've always been kind of concerned about that because he doesn't really believe in anything. So why not just do that? I do think, though, what's ironic is that in some ways, what kind of the response that Vice President Biden was talking about leads more to an NHS model, if you think about it, right? Where you're essentially, these clinics and these facilities are essentially being run by the government. Centene, which is I think it's the largest private for-profit HMO insurance company that runs Medicaid programs, is actually facilitating funding and resources to federally qualified health centers. So they're essentially contracting out that function, which the NHS does in Britain. So you'd say, well, why bother? Why give Centene their 10% or whatever it is off the top? Just do it directly. So I think there is something about this transition that first we finance it, and then we figure out that really the only way to maintain it and ensure that it's there is to run it as a public system. And so I think that could very easily be a natural evolution.
Great. Thanks, Michael. So the next question that we have, you kind of touched on this a little bit in your presentation. Can we build can we be building in the labor movement to win Medicare for All? And how have healthcare workers already made major strides towards universal healthcare? Another one sort of connected to this would be, should doctors and nurses strike due to shortage of PPE?
Yeah, that doctor strike is a tough one. I think they have to take collective action if they aren't going to do the PPE. They're not going to provide adequate PPE. NNU did demonstrations at 15 hospitals a couple of days ago in California. I think that if they don't respond to that, then I think it has to be escalated. I wouldn't, striking in the face of a pandemic is problematic for sure. But on the other hand, what's going to happen is there are so many healthcare workers are going to get sick that you're going to find ourselves in a similar situation. And so that's very much a problem. I'm sorry, Christy, you cut out on the other question. What was...
So the first one was, can we be building in the labor movement to Medicare for All right now? And how have healthcare workers already made major strides towards universal healthcare?
The healthcare workers, whether I think really across the board, are now very clearly committed to Medicare for All. You've got 1199, SEIU 1199, a major hospital workers union, healthcare workers union in the state of New York, on board with New York single payer. Obviously, the California Nurse Association is leading in California. SEIU in California supports it as well. They're working with the Healthy California for All Commission, which is really the single payer commission in California. So at the local level, there is broad support for Medicare for All, and always useful to work at the local level with labor leaders on this question, because they are with us. Those who are bargaining the contracts, those who are representing the workers, they get it, they're with us. At the international union level, the politics are very different. In my view, they're led by the electoral alliance with the Democratic Party, and that's why I believe that if we have to move the Democrats who are providing cover to the industry and using the unions and using their leverage to get the unions to back them up and say, yeah, we really want to keep this benefit. When in fact, every union knows you've given up wages, you've given up pension, you've given up security, and you're letting the boss have that leverage where you will virtually, give up whatever you have to keep the health benefits, or go on strike and then lose the benefits as the UAW did. So that's where the support is. At the international level, we move the Democrats and the unions will follow, I think.
That's really helpful. Thanks. Our next question is, during this crisis, how much should we emphasize fighting for state level guaranteed health care versus more expansive federal relief options?
We have to understand that the state fights are first political. They are not primarily efforts to show, we can do pure Medicare for All or pure single payer at the state level. We can do universal healthcare that guarantees healthcare without barriers to care. Will that be the kind of robust, seamless, and effective, equitable national program? No, it won't. But what it does politically, if the two largest states in the country, the one most affected by COVID, says the way we can rebuild our healthcare system, prevent this kind of impact in the future pandemics, be positioned for climate crisis, and guarantee healthcare for everybody, is to do single payer in our state, I think the political moment is ripe and the political impact is profound. And you can go to a Joe Biden administration and say, okay, you want to, see how this works? We'll show you. That provides huge political momentum, gives us a great organizing target at the federal level, and enables us to create the political momentum. You get members of the California congressional delegation, the New York congressional delegation. Yeah, it's working in our state. You can see the impact. That, I think, has political value. The folks in Washington State, I think, could make the same argument. They had a very robust public health response to COVID-19. In fact, they had the worst outbreak in the country, and then they're more on a pattern of flattening the curve better and more effectively than almost any other place. So there are two paths. Washington, which really does have an orientation toward public health and these kinds of solutions when it comes to healthcare, versus New York, where the governor was actually denying the severity of COVID not that long ago and was late to the shelter-in-place order. So those are two lessons. I would say I think the folks in Washington State have a huge advantage now, blown past the public option and all that crap, I think, and moving toward the ability to really push single payer there.
Mm. Michael, we have so many good questions. I'm just going to keep hitting you with them, but they run the gambit. They're really, really expansive. So the next question kind of goes in a different direction. What is the strategy to use COVID-19 as an entry point to strengthen the Bernie Sanders campaign? What are your thoughts there?
I do think it's a great platform for us because it really does reveal the gaps and disparities and equities that the senator has been campaigning on. And so I think that if you want someone to show leadership, you engage in a specific program to make change, you get amendments and bills, those get passed and things happen. You move the window of political possibility. That's what the senator is doing. At the same time, they've made, I think, the campaign have made 300,000 calls into Wisconsin, reached over 1 million voters. Fortunately, they decided not to put people's lives at risk by forcing them to go vote. I guess that's kind of a Republican, survival of the fittest approach. But fortunately, that's not happening. They got till June 9th. So I do think linking the Sanders campaign to this fight around COVID, to addressing the pandemic, is actually the best way to show why these kinds of collective public solutions are the only way to solve our problems and to act together. So yes, I do think that this is a great moment for the campaign. Certainly don't think we ought to be talking about suspending it. We ought to be talking about expanding it and really building it as a vehicle for this fight for, say, a Marshall Plan. Really, it's not even a bailout. It's a Marshall Plan for this country to put it on, to lay the foundation and structures that we should have done decades ago.
That's right. So next, what is the best talking point against the public option?
Doesn't guarantee healthcare and eliminate financial barriers to care. It maintains administrative complexity, doesn't necessarily cover everybody, requires huge out-of-pocket costs. So what problem has it solved? Coverage is not healthcare. Access is not healthcare. For example, I can walk into the lobby of the Four Seasons. I have access to the Four Seasons. Can I rent a room in the Four Seasons? No, I cannot. That's like having healthcare in a private plan that has networks, right? I can only go to certain hotels, certain hospitals. And so I do think that fundamentally, it doesn't guarantee healthcare or eliminate the barriers to care. What it does do is, in some plans, require people to pay 8.5% of their income as premiums and pay copays and deductibles on top of that. It still lets who chooses? It sounds like your employer chooses. So he's going to have some people on the public plan, right? Maybe others aren't. Who chooses? It's very complex administratively. It's really ultimately a bailout of the insurance companies, because what do? Oh, well, the public plan will be less expensive and the benefits will be better and we won't have the copays will be less. Okay, well, who's going to get into that plan? People who need health care. What are the insurance companies going to do? Hey, I got this really cheap plan for all you healthy people. The deductibles are high, but you don't really need health care anyway. Flock to them. That's their business model. Cover people who don't need health care, charge them a premium, and you're golden. Meanwhile, the people who actually need health care on the public plan, it goes down. Does it start acting like a private insurance plan? Oh, see, government healthcare doesn't work. I think it's a recipe for disaster. It doesn't lead to single payer. It goes in the opposite direction. When we're actually needing a government guarantee of healthcare, it basically says, we'll subsidize you and see how it goes. And we'll create a plan, hope it works.
Mm-hmm. Mm-hmm. Oof. So talking points, there are a lot of them. It's really bad. So there's a lot of talking points against it. Thank you, Michael, for those. How would Medicare for All tackle big pharma is the next question. Would universal health care include pharmaceutical markets?
Yes. And this is the other thing too. You can't reform prescription drug prices and leave the rest of the system intact, because the pharmaceutical corporations, the hospital corporations, the health insurance companies, they're all just in a war for the piece of the healthcare dollar. Now that war ends up raising the costs of healthcare because, of course, they have no incentive to lower the cost, since as the costs go up, their percentage results in more profit. Their percentage of take results in more profit. So, an industry cannot obviously solve this problem.
Yeah.
Yeah.
Well, we've been speaking with Michael Lighty tonight, the Healthcare Constituency Director at the Sanders Institute. Michael has laid out a pretty clear opportunity for the left to link pressing current demands to a broader ideological struggle in which we're engaged now and will be engaged in for all of time to come, or for as long as we can see into the future. I just want to give Michael a chance again to really underscore the three principles that you're saying could be applied now and establish the rationale and programmatic basis for a single payer down the line. Could you just go over those one more time for those who might be tuning in a little bit late?
Enhance the public health infrastructure, eliminate financial barriers to care, engage in social solidarity. If we're able to win the debate over healthcare during the pandemic on those principles, that's the foundation for Medicare for All. And then if we actually are successful in proving that a robust public health response is effective, and we're able to show how eliminating barriers to care improve treatment and care, and then say, yeah, we did social distancing. Hey, in California, we did it early, flattened the curve, didn't overwhelm the healthcare system. We can take care of each other. Then those are programmatic examples of why Medicare for All works. So it is effective both in terms of creating a kind of a paradigm, a kind of ideological paradigm for how we want to think about healthcare in the pandemic and after. And it also creates the basis for showing that these programs can work. And that they're, I think, in that sense, the pandemic is really kind of what we were all afraid of, right? Because we knew that the healthcare system didn't have the capacity to deal with it. But we also, I think, have been aware that if we can actually reform the system and address the gaps that the pandemic has revealed, then we actually are in a stronger position to win.
Right. So you've just laid out the sort of programmatic vision, and I think there are a few questions in the chat box that are asking sort of how do we get there? What will actually move our politicians? And maybe if you could speak to that question of how do we move the politicians, the electeds that we currently have in office, to actually get us on this road that seems like the obvious choice for us to move forward, not just to address the crisis, but also to provide more equitable, more efficient healthcare for people down the line.
Right. I do think that we have to be I want to say more aggressive, but it's not because we're in the context of the pandemic. That might not be the right word, but we have to be more I hesitate to use the word persistent as well, but I will. We have to be more persistent on this point, because the truth is that up to this point, the members of the U.S. House of Representatives who are not on 1384, the Jayapal Medicare for All bill, do not believe that their lack of co-sponsorship will cost them their job. And arguably, until they do, they won't change their position. However, when you've got hundreds of thousands of constituents unemployed and no health care, and without COVID-19, right? They're not sick with COVID-19, but they lost their job and they don't have health insurance. What are you doing for them now? I do believe that personal stories about the pandemic, about their economic situation, will move these people, because ultimately you even hear this from Anita Dunn, who is the senior advisor to Joe Biden. She says, the pandemic proves our case. Government is part of the solution, the fundamental part of the solution. This is a centrist Democrat, a neoliberal whose boss has spent his career in the lane of privatization, mass incarceration, imperialism, arguably some of the other stuff, right? And yet on the domestic side, oh, government is the solution. If we just change the paradigm shift from neoliberalism to liberalism, right, among the centrists, then the debate within the Democratic Party is very favorable to us. Socialism, social democracy, liberalism, that's a frame where we can make some programmatic gains that ultimately prove the effectiveness of our solutions. So that's, I think, two-part. One is there's the persuasion through stories. The second is the electoral calculation, making it very clear that they cannot count on having a job unless they step up and provide us security and guaranteed health care and the other economic demands that we make. And then I do think it takes this broad movement to say everything is everything, and we've got to coalesce the energy of the Sanders campaign and the huge organizational mobilizations that are going on around the people's bailout and around protecting workers, and the strikes that are going on, or the worker actions going on in the frontline workplaces. All those point to, I think, the potential for something that could coalesce into a force that literally the Democrats could only ignore at their peril. Last comment, I thought the comments of Steve Bannon today were the most fascinating politically, because Bannon is, do you see that, Christy?
Can you summarize them?
Oh yeah, so Bannon is basically arguing that the pandemic is reorganizing American partisan politics along class lines, which has kind of been his perspective all along, and that essentially the Bernie working class and the Republican, working class are going to unite through an economic nationalist expansion of government. And this is very problematic, because many of us on the left were quite concerned that Trump would go into this kind of economic right-wing populist nationalist direction, and he hasn't so far. But now Bannon's arguing that the pandemic will reopen that door, and there will be an alignment where these folks who want a government, to address these the dire situation of working class people in this country, and they'll link it to hatred of China, to hatred of immigrants, to a nationalism, unless the left is able to coalesce these forces around our program and solidarity, with Medicare for All being kind of the leading program and example and demand that can demonstrate solidarity. We could potentially go into a nationalist direction, and the kind of working class-based party that many of us envision turns into a far-right party like those in France and Italy and Eastern Europe. So that's also, I think, what's at stake here.
Well, this has been a wild ride, Michael. You have raised our hopes. You've redrawn the lines of kind of political possibility in the U.S., looking towards single payer down the line. And then you've ended on this very scary note of, we really, the stakes are very high. This could go one way or it could go another. And we have a lot of work to do on the left to make sure that it goes one way and not another. So thank you for laying out some of the changing conditions and the changing opportunities that we have under those conditions. Thank you so much again, Michael, for joining us. Just a reminder that part of Jacobin's Stay at Home series includes our next episode. Tomorrow night will be Touré Reed, who will be speaking on the pitfalls of liberal anti-racism and woke neoliberalism. We'll be doing these again nightly, 6 p.m. Eastern from Monday through Saturday. And for tonight, I just want to thank everyone who's been listening, providing comments and questions to Michael. This has been really productive. Thanks, and everybody take care out there. Have a good night.
Thank you, Christy. Thank you, Jacobin. Yeah.